The following portion of the Arizona Daily Mix is sponsored by Cactus Canyon Medical.
Most people know by now, but for the uninitiated, what are GLP-1s and how do they work?
Okay, so GLP-1 is a glucagon-like peptide. It's a once-a-week injection that helps your body metabolize food appropriately, but it also helps trigger the brain that you are replacing that hormone, so we stop craving foods.
I feel like culturally, we used to blame people for being overweight, and now there's a lot more sensitivity around the fact that it can be an addiction. It can work like that in your brain.
Yes, being overweight or obese is a metabolic disease, and we need to treat it as such. So by taking these medications, it would be like taking a blood pressure medication. If you have high blood pressure, you take the medication, it corrects the blood pressure. So we have to look at this as a disease and not just a lack of willpower, and stop blaming the person in front of us.
You've worked with people who have a little bit to lose and a lot to lose, and at first people were hesitant to treat somebody that needs to lose 5 or 10 pounds with GLP-1s,
Right.
But you're doing that.
Yes, I do that because I believe in preventative medicine, right? So why wait till somebody has diabetes? Why wait till somebody has 50 pounds to lose? If you have 5 to 10 pounds, you're eating right, you're exercising, you are doing all those things correctly, but you're still not able to get that weight off. These medications can be right for you as well. Yes, so you don't need to lose 50 pounds to be on these medications. It can be that 5 to 10 as well.
And have your patients have luck keeping off the weight?
Yes. So one of the reasons I started this clinic was not just to help patients lose weight, but maintain it and keep it off forever. And so I just saw a patient yesterday who has been off of the medications weekly and taking a monthly injection, and she's kept all her weight off for over a year now.
It's very impressive.
Yes.
Because almost every diet, there's recidivism.
Yes.
People gain the weight back,
Yes.
but your people, they do some maintenance.
Yes, you have to do maintenance, because if you treat this like a disease, right, stopping the medication, the disease will come back, right? Mm-hmm. And so when you are in your initial phase of losing the weight, the injections are weekly. Once you get the weight off, though, we start to spread out the dosing. So sometimes we start with 10 days, 2 weeks, 3 weeks, and then once a month is about typical what patients will take the medication.
And the way it works here is that you see patients via Zoom.
Yes.
Once a month?
Well, I actually prefer patients to come in weekly in the beginning.
Okay.
So the data is coming out that 1% of all medical providers have any obesity medicine training. And if you get these medications with a provider that doesn't have that training, 64% of patients will gain that weight back and stop the medication because they're just not getting that attention and the education and the follow-up that they need. So here we like to see our patients weekly in those beginning phases so that we can make sure that they're getting the education and getting the care that they need.
Well, getting to the nitty-gritty,
yes.
You prescribe 2 different GLP-1 and a related drug.
Yes. So semaglutide and tirzepatide, they're both considered GLP-1s. They're both once-a-week injections. Semaglutide is a little bit more affordable. Tirzepatide costs a little bit more, but tirzepatide also has less side effects. So in that initial consultation that I spend with you, we decide on what drug would be more appropriate for that patient.
You do hear some horror stories. What are the side effects that
Yes.
you see?
So the most common side effect can be constipation,
okay.
Nausea, vomiting, and then diarrhea. But again, if you are getting the guidance and you have the education from a healthcare provider that you're meeting with weekly, those side effects tend to be less in those types of patients that come in versus if you're getting it online and you don't talk to a healthcare provider for, 4 to 6 weeks.
If someone's interested,
Yeah.
How can they get in touch with you to find out if they're a good candidate?
Yeah, so you can go online, you can give us a call, and then we'll get you scheduled and it's an hour consultation. This isn't going to be a fast process, and so you will hang out with us or hang out with me for an entire hour. We go over a body composition, we go over your health history, your challenges, your strengths, decide what medication is going to work best for you, and then we can get you started.
I'm glad you said that because it has to be a thoughtful process,
Yes.
not a quick process.
No, it really shouldn't be, right? And so another reason I started this practice is because I was working for other practices where you had to see patients every 10 minutes, and I don't want to practice that way either. And so I want to be able to spend time and give my clients the attention they deserve.
Last question.
Yes.
What has it been like for you to walk through this process with so many people?
Well, I feel honored and privileged that I get to do this. It really changes people's lives, and I'm just glad that I can help.
Thank you.
The preceding portion of the Arizona Daily Mix was sponsored by Cactus Canyon Medical.